And I love that you spoke about knowing your normal. I'm a big advocate for that. Make sure you do all your self-checks, including checking your vulva. Very important. Check your breast, check everything. Know yourself. Understand your menstrual cycle. Understand yourself and your body. Because if you notice anything, you notice it early and you get it checked out, and it gets checked out early, and it ends up being something sinister like cancer, again, rarely the case. The hope is that it's picked up early where it's more likely to be treatable, and the treatment is successful, curative, and less invasive as well. Especially as women, we do a lot of is, oh, okay, I'm busy right now, but I'll get to it. And then we keep delaying it. And, man, I'm so busy. I can't deal with this right now.
Hello and welcome to Menopause Whilst Black, the podcast that is committed to sharing the menopausal stories of Black people, primarily based in the UK. I am your host, Karen Arthur. I am a broadcaster, an artist, a grandmother, a mother, and lots in between. And we are on season 7 and we've reached episode 4, and I'm excited to bring our new guest to you. But before I go on to that part of the recording, happy Black History Month in the UK, and also happy World Menopause Awareness Month. This year's theme is menopause hormone therapy. So expect to hear a lot of people talking about how, for some, menopause hormone therapy. Notice I didn't say HRT, which is hormone replacement therapy. The language is changing. And so the term is MHT. So expect to hear lots of people talking about it, explaining about it. This is your opportunity to find out a little bit more about how, for some people experiencing menopause, I need to make that clear, this might be the best optimum way to look after yourself during this transition. So, are you ready? I don't know whether you are actually. Get yourself ready anyway. However you listen to this podcast, wherever you are, I hope you enjoy, and I will see you on the other side. Bye. Hello and welcome to Menopause Whilst Black, the podcast that is committed to centering the stories of Black people in any stage of menopause. My name is Karen Arthur. I'm your host. I'm a broadcaster, an artist, a grandma, a mother, a daughter. I could keep going, and everything in between. And I have a brand new guest for you today for episode 4 of season 7. I will read her bio. So, Dr Aziza Sesay is a GP educator, honorary senior clinical lecturer, host, speaker, and well-regarded health content creator. Dr. Sesay is particularly noted for her work in health education, awareness, advocacy, and empowerment through her platform, Talks with Dr. Sesay. This platform shares evidence-based health information with a focus on women's health, cancer awareness, mental health, and health inequity. Dr. Sesay is the Vice Chair and Creative Director of Black Female Doctors UK and serves as an ambassador for multiple health charities, including the Eve Appeal, Wellbeing of Women, and Keep It Facts. She has also been featured on various media platforms with insightful contributions to public health discussions and has authored a number of health articles. Additionally, Dr. Sesay has collaborated with numerous organisations, including NHS England, and she has played a pivotal role in several national public health campaigns. Dr. Aziza, welcome.
I always feel so awkward whenever you read the bio. Oh my God, I sort of was melting. I feel like the witch from the Wizard of Oz. I'm melting.
It's so funny because when I first started this podcast back in 2020 now, October 2020, I didn't read the bio out. in front of the guest. I read it afterwards. And then when I did do it once, I loved the response, because you were beaming, even though you're like, I'm melting, I'm melting. Actually, it was really nice to see your response to me. And we cut that down, didn't we? Because you've done a lot at your relatively young age.
Thank you so much. Honestly, Karen, it's such an honor to finally be on your podcast. When you sent me an email, you know how you're supposed to wait, like, okay, I'll email her back tomorrow. I was like, yes, when you need me. Oh, next week, yes, available. Let's do it. So,
oh my goodness,
yeah,
I love that. I love that.
I have
So
so much respect for you. And I think this podcast is so important because as a marginalized community, as, someone who will go through menopause one day, it's nice to have the storage of information with a wealth of guests and knowledge that I can even resort to hopefully one day.
Thank you for that. I will take that. I appreciate you saying thank you. And as you know, normally I am interviewing Black people experiencing menopause who are in perimenopause or menopause, but I thought it was really important for part of season 7 to be also talking to people who are working with people who are going through menopause and also advocating for menopause equity. So let's talk about you first, though. Am I calling you Dr. Aziza, Dr. Sesay, or something else?
Please call me Aziza. I always say that Dr. Sesay is my uncle.
So right. Okay. All right. Fair enough.
Call me Aziza. That's fine. Thank you.
So tell us about yourself, Aziza. Who are you outside of all your accolades?
Yeah, thank you so much. Okay, so I really thought of this question, and I think what's really important, first of all, is to answer where my accents come from, because that's the first question a lot of people ask.
Because everybody's wondering.
So I am not American, for anyone who's listening in. And Americans usually ask me where I'm from when I'm there, because they're like, what accent is this? You're not using our dialect. What's going on? I am actually originally from Sierra Leone, but I was born and raised in Saudi Arabia. I went to international school, had American teachers, American friends, watched American TV shows. It was such a cool accent to have. I emulated it so much, I cannot get rid of it. I've actually lived in the UK for over 22 years, and I still have people saying, hey, welcome to the country.
Oh,
I'm British now. So that's me. I am a mom of 2 really energetic children, 6 and 3, and I'm also a wife, and I am a sister to 4 sisters. Don't have any brothers. My sisters definitely keep me grounded. In fact, I put a picture on my Instagram stories today, just trying to be all cheesy, like love always wins. Considering what's happening in the UK right now, and one of my sisters are like, Aziza, did you look at this picture before you posted it? So they keep me grounded. But yeah, I'm just a human being who wants the world to be better and who genuinely wants to help people. And that's why my platform exists. That's why I exist. And I just hope I can continue to live up to that legacy that I want to leave.
Well, you're also a shining light on the gram, I will say. I mean, this woman, yes, you heard her bio, so you know she does a lot of things. She's also just told you she's the mother of 2 young children, energetic children, and manages to be also very vocal and present and informative and funny, and bright on Instagram. So if you don't follow her, it's Talks with Dr. Sesay. Do go along and have a peek at what she's getting up to, because and I also want to see that picture, so I'm going to rush off and look at that.
I'm about to delete it.
Oh shit! I'm sorry. Well, I'll have a look before you delete it. Anyway, so you said your heritage. You were born in Sierra Leone, and I'm going to presume that both your parents are from Sierra Leone, or you can tell me something else.
Yeah, so both my parents are Sierra Leonean. I was born in Saudi, actually, but
I'm
Sierra Leonean heritage. So my dad actually grew up in Egypt, and my mom grew up in Guinea. It's all over the place, but
I was gonna say a true multicultural human being that you are. And where are you based now?
So I'm currently in the UK, in the Midlands, I kind of moved all over the place. But after I had my daughter, London was a little bit too hard, especially as we didn't have any family there. So moved back to the Midlands, back to where it all started when I moved to the UK, closer to my aunt.
And how old are you, Aziza?
How old am I?
Yes.
Oh, so I am 37 years old. I am getting older. And that's another reason why I was excited about being on this podcast, because it is around this age, right, that a lot of Black women actually start
Mm.
to show the symptoms of perimenopause. So, though
Yeah.
I
And
don't
you don't even realize it.
yeah, and don't really realize it. And it's because I think when you think about a woman going through menopause or even perimenopause, it's always a white woman, who's
Yeah.
older, who needs a fan. You don't
Mm.
associate it with someone who looks, as young as me, going through the symptoms. And hot flushes, though it's one of the most commonest symptoms of menopause, it's not the only symptom.
Yeah,
So
100%. So obviously, I want to ask you who taught you about menopause, because we would assume that you would learn it during your medical training, but I don't know. So let us know who taught you about menopause.
So we touched on menopause in my in my medical training.
Just
That's a fact.
touched on.
We touched on it. We did go through it, but we didn't go through it in too much depth. And I can say the same for my GP training as well. We didn't have that much depth in it, or at least
Mm,
it wasn't mandatory. You could kind of continue without needing necessarily to gain expertise in menopause, which actually
mm,
is a shame, because as a GP and also as a female GP, I tend to see so many, women patients who come in, and also patients who come in about menopausal symptoms. So it is
mm,
a shame that there are people who graduate and get on to becoming GPs who literally don't have a clue about menopause, or don't
mm.
have that much expertise when it comes to something that happens to more than 51% of the population. But I know that things are improving, but that is the reality. And I guess part of why I want to emphasize this point is this is why sometimes a woman might go to a GP and they don't seem as well equipped. So if you
Mm.
feel that and you find, okay, this doctor isn't listening to me, one thing I really push for is for people to be aware that they can go and see another doctor. You can seek a second or a third opinion. Another
Mm.
important thing that I always highlight, because not many people are aware, is if you go onto the GP website, or even if you go onto NHS Choices, they will give you the list of names of the GP, and often there are letters after their names. So if they
Okay.
have DRCOG, that stands for the Diploma with the Royal College of Obstetrics and Gynaecology, or if they have the DFSRH, so that's the Diploma with the Faculty of Sexual Reproductive Health, often it means they have some sort of women's and gynecological health training. So you
Mm.
probably fare better with those sort of individuals. So yeah, um, as GPs, we are literally generalists. We have the breadth of most things. We're
Yeah.
not specialized. Not all of us are specialized in all the areas. So
Mm.
I do have specialist training in women's health. I'm gaining my expert training in menopause. So I have basic training, but I'm trying to become that menopause specialist as well.
Yeah.
And those are
Yeah.
things that we can go into and we choose to go into. But then you have different GPs who may choose to go into being a specialist in diabetes or a specialist in asthma
Yeah.
or cardiovascular. So that's what's important to understand. So whilst they might not be that great when it comes to women's health, they actually probably will be incredible at those other aspects. So it's important to remember that. So sometimes when you feel like, okay, this GP doesn't know anything, you're probably right. They don't know anything in that subject, but they probably
Yes.
know a lot in the others. And that's why it's
But
always
I
second or third or fourth
Yeah,
opinion.
and I suppose that what our concern is, as people who work with the menopausal women or speak to people who are experiencing menopause, is that by the time you get to the GP, often you can be quite desperate.
Yeah.
And, I give that advice as well about you have the right to see another doctor, but you and I both know how difficult it is to get a doctor's appointment through no fault of the NHS, just getting time off work, or recognizing that you do need to go to a doctor, or when if you've had a not very pleasant experience with a doctor before, as happens, you're not going to want to see someone again. It's like, am I going to go through this again? But I feel, is there an advice, do you have any advice to someone who's like maybe got to go to a second doctor and really feeling like, oh, is it worth it, I don't want to do it,
Yeah.
and yet they know that they're having some kind of symptoms or something's not quite right?
Yeah. So I wholeheartedly, first of all, apologize that anyone has gone through that
It's not
experience.
for you to apologize,
No,
babe.
I know, but I think it makes people feel, I've noticed anyways, when I've apologized to my patients on behalf of just a bad experience. Often
Yeah,
they feel like, okay, I feel like I'm being
yeah.
listened to. So I
Okay,
always tell
okay, I hear that. Yeah.
nobody should feel dismissed. Nobody should feel like they're not being listened to. So sorry
Mm,
that that's even been an experience. But the reason I always push for these sort of conversations is so people are aware that they shouldn't, please don't give up, and that there are others out there who will hopefully help you. There are options.
mm,
So what I would always say is equip yourself with knowledge. Why
yeah,
we do all of this, right, Karen, is so that we can put the information out there. So there's something about having the confidence in the knowledge that you've gleaned so that you're able then to express yourself again with confidence when you see the doctor. And you're able to sort of pinpoint the aspects that you want to discuss,
mm,
and why you feel that, for instance, oh, I definitely think I'm going through perimenopause and I'm 35 because of this, that. You can put them all down. I always say prepare yourself for the appointment. We are always
mm,
going to ask you what your symptoms are, how they've started, how they've progressed, what have you tried, so on and so forth. If you have all of that information, that makes the conversation easier and smoother. If you're
yeah,
really nervous and worried, go with someone else. They can be your advocate. And it always, whenever, you see an adult with another adult, it's like, okay, no, they mean business. You cannot, and if you as a patient that aren't confident enough to say something, the person you bring with you can say, well, actually, can you elaborate on that? And that's another
yeah,
point. You can ask questions. That is
yeah,
your right as a patient, as a human being. If the doctor is saying something to you, or if they're saying that they can't do specific investigations that you want them to do, ask them, well, why not? Or
why
how
not?
did you
Yeah,
come to that conclusion? Or,
yeah,
just ask questions. When you're not sure about something, ask for clarity. That 100% is your right. We've moved past the paternalistic medicine days. It's all about patient-centered and shared
yeah,
approach, isn't it? Because you're an
yeah,
adult like I am, you can make your decisions as well. And we just have to lay everything on the table, give
mm,
you all the information, and reach, again, a shared care plan that works. Because I've also found, and it's really hard as a GP when we only have 10 minutes, and this is why I always overrun, but taking that extra time to really emphasize why it's important. I'll tell you a really quick story. I hope you don't mind.
not at all.
What I
Speak
thought,
away, my dear.
all right, because I don't, tell me when to stop.
No, you know, it's all valuable stuff, babe.
So I love this story, and it's real because it's happened recently. And again, for me, it really emphasized the need to have the conversation and just be open with the patient. So I had an elderly patient come in with her daughter. She didn't speak English that well, but she understood
Mm,
what I was saying. And I could tell she could understand what I was saying. And you could tell that she was over there already ready to, dismiss everything that I was saying to her. And it was with regards to her taking cholesterol. Sorry,
okay.
not cholesterol, statins, because she had high
That's,
cholesterol, and she'd had it for quite a long while. She'd already seen 4 different doctors, and she'd already said, "I am not taking that medication. There's nothing you can do." And when I started to talk about it, her daughter was like, "Look, she's not going to take it." And I was like, "No, let's have this conversation. Let me explain everything to her." And we went through everything. Went through why you get high cholesterol, why it's important to keep the cholesterol down, what can happen if your cholesterol remains high, so on and so forth, the complications. And I said, look, this is the medication, this is how often you need to take it, this is the dose, so on and so forth. And if you don't like it, there are alternatives. Went through the whole thing. And then when I was done, her daughter was like, yeah, my mom, and her mom looked at, sorry, the patient who was the mom looked at her daughter and was like, no, I'll take it. And I was like, see? But she said she would take it because finally someone explained it all
mm,
to her. So it
yeah,
made sense. And even
yeah.
her daughter, like her mouth was wide open, like, what? Are you serious? Okay,
And
that's.
sometimes that is also about having to hear the same thing from someone
Yes.
else.
Yeah.
My daughters might not listen to me, but they might listen to each other, or they might listen to my friend or their friend saying exactly the same thing, and that's absolutely fine, but there is something powerful about having things explained to you. I get quite anxious when I go to the doctors, but I'm also quite confident, so I will say straight up, I'm anxious, you need to tell me what you're doing. You need to, and I'm not afraid to complain if it hasn't gone, in the way that I haven't been treated with culturally competent care, as they call it. I will also say that my experience is that when I've gone to the doctor, when my kids have gone to the doctors with someone, or I've gone with them, that it's gone much smoother, because often we grow up thinking that the doctors know everything, like you said, the patriarchal role, approach. And so when you're confused and flustered and you're upset, you're not taking in information, whereas having someone else there. I've been in the doctors with one of my daughters, and she kind of glossed over all her symptoms, and I went, yeah, but you said this, and she'd just forgotten.
Yeah.
So that's really, really good advice. Thank you so much for that. So let's hear it from someone who knows, for someone who's listening to this, first time they've stumbled upon season 7, episode 4. Where have you been, first of all? What is menopause?
Oh, okay. Yes. Do you know what? I love that. I think that's such an important question. And, I really love that you said hearing something for the first time, even though you've heard it a million times. And there was a quote by a professor that I heard that is what keeps me going, because I feel like I've explained what menopause is a million times, but I never get bored about it, because when you say something for a million times, it could be the first time that someone's heard it, either heard it for the first time or listened, paid attention and taken it in. So let's just keep repeating what menopause is.
Because there are a lot of assumptions as well. People assume, people know what menopause is, so we'll just tell them what to do.
Exactly.
Actually, lots of people do not know what the term is. They don't know what it means. They're just kind of not having a great time, and know that it might be loosely connected. So what is it?
Great. Okay, so when we talk about menopause, often people lump it all into one big term, that is menopause. But there are different phases within menopause. But menopause is a natural transition into the end of the reproductive process. Okay, it is when a woman has not had a period, natural menopause, not have a period for exactly 12 months. So that means you're in menopause. If you're not on any hormonal remedies or anything like that, and you've not had a period for 1 full year consecutively, you are in menopause. The day after that, you are officially postmenopausal. So actually, menopause only lasts 1 day, and it is the shortest part of the phase. The rest of the time, so the rest of the woman's life who's gone through it is postmenopause. And we live at least 30% of our lives in postmenopause. So, the narrative that, my life is over after menopause. Nah, baby, there's so much more to do, so much more to achieve.
I'm here to tell you it is definitely not.
But even before that, we have peri-menopause. So peri-menopause is the period around the menopause. So peri means around and menopause. And that can last between 4 to 8 to 10 years. Right? For some people, it can last several weeks. For others, it can last, as I said, up to 10 years. And in that phase, you can get the similar symptoms as you would expect around the menopause. So often when people talk about menopausal symptoms, they're also talking about the symptoms that occur during the perimenopause. And for some women, the symptoms are much worse during that period than afterwards. So it's really important that we have this discussion. But I usually like to visually, and I don't know if you're going to show this as visual as well as the audio, but just remember that perimenopause is that long. Menopause is probably just that long. And then postmenopause just keeps on going, until we're no longer in this earth. So really important that we know this distinction and that we look at it as a whole rather than just that one little bit, which technically only lasts a day.
Yeah, exactly. And people are always surprised by that, because we like you said, we lump it all together. So how will they know that menopause is and we are talking about natural menopause. We're not talking about surgical menopause. Can you explain a little bit about surgical menopause and what the difference is?
Of course. So natural is where you just go on to have it. You know, you you get older, you get to the age usually around late 30s to mid 40s. That's around the time that it starts. But when we talk about surgical menopause or even chemical menopause, that's menopause that is induced, and it's an immediate, sudden thing that happens. One, because they take out the ovaries. So it's our ovaries that are releasing the hormones, estrogen, progesterone, and a little bit of testosterone. So yes, women do release testosterone. There was all that going on on the Olympics recently. We release a little bit of testosterone, and that is normal. If you have certain conditions, you may release more than others. But anyways, I digress. So it is the estrogen component. And you know what? I always carry these around. So it's the estrogen component.
Now, this is why I'm glad I'm on YouTube. Keep going, baby.
You are on YouTube. Yes. Okay, perfect.
For those who are listening, tell everybody what you're holding up.
Oh, you tell everybody what I'm holding up.
You see, now she's got me going. You put me on the spot. Do your teaching, doctor.
All right. Well, this is the internal gynecological anatomy, okay? So we have the ovaries on either side, which is what I was just talking about, that release the hormones. It also releases the egg once a month. And then the egg travels to the fallopian tube, which we have one on either side. Then it goes into the womb, which is this structure here. And then the neck of the womb is this, which is called the cervix. So I'm quickly going to say, please, if you get invited for your cervical screening, please attend. It can save your life. And then you go down into the vagina, which is on the inside. You cannot see you can't really see the vagina on the outside. Vagina has the word in, meaning inside. And then you have this little bad boy that I carry around literally everywhere to every conference that I go to, which is the vulva, the external part of the female genitalia. So
thank you.
Why I picked it up was I just wanted to explain that, the ovaries is what secretes the estrogen. And it's the estrogen, which we often look at as just a reproductive hormone, but actually it is a pretty amazing hormone that covers so many different aspects of our lifestyle, of our brain, right? It helps with cognition. It helps with our heart, our cardiovascular, our heart and our blood vessels. It helps with the cholesterol. It lowers the cholesterol. So it's very protective of our hearts. Up to the age of 50, we're at lower risk of having heart attacks, strokes, and so on compared to men because of this beautiful hormone estrogen. It also helps with our mood. It controls the chemicals that are being released that makes us feel good and happy. It helps with our bone strength. So what happens is our bone goes through what's called a remodeling process where it breaks down and then it forms. So it helps to increase the bony formation. So it's no surprise then when we lose our ovaries, right? Or we take a chemical such as chemotherapy or even a drug that stops the production of estrogen, it's no wonder that we then get the symptoms associated with menopause and perimenopause. So we get the brain fog, we get the muscle aches and pains, the joints aches and pains, we get the hot flushes, and we are also at increased risk of having fractures because of our bone being thinner, osteoporosis. We're at increased risk of having heart attacks and stroke. In fact, the leading killer or leading cause of death in women over the age of 50 is cardiovascular disease, is heart attacks and stroke.
And I only found that out when it was the focus of World Menopause Month one year, and I was like, "You are like, this is something that we need." Why do they focus so? Well, we know why they focus so much on men. Let me not ask a stupid question.
No question. That's stupid, but that's the point. Yeah. So, so what I was saying was surgical menopause, chemical menopause is induced. It's not natural, and it's also immediate. In that moment, as soon as you have your ovaries out, as soon as they give you those medication that stops you releasing the hormones, you will go through menopausal symptoms. It's also important to talk about the premenopausal, premature menopause, I beg your pardon. So such as primary ovarian insufficiency. So in individuals who have this, they just don't release the estrogen. And we don't understand why. But as with most things in women's health, we never understand why all of these things happen. But it can happen as young as the age of 18. You know, you have 18-year-olds who are basically going through menopause. And this is why this conversation needs to be had at all levels. And I'm a big advocate, and I really push for education in schools. And I'm not saying that we need to educate to scare anybody, but it's important that everyone is made aware about these changes and what can happen and how it may affect individuals. It's helpful as well, because I'm sure teenagers will have moms who may be in the perimenopausal state, and it gives them that understanding of what's happening. Like, oh my God, my mom doesn't hate me. She's just really going through it right now. So spiral learning, age appropriate learning, and starting it early. And then obviously, again, I'm a big advocate of educating men, because even though it's not happening to them directly, it will affect them. It will impact them indirectly, whether it be their wives, their partners, you know, their siblings, their sisters. It's important that everybody is aware and educated on these things, and educated early.
Thank you. I want to get onto the bit about people being scared, because I think that links directly to how we can prepare for it. I think there's so much linked between menopause and aging, and how aging is a bad thing, but a lot of people tend to bury their head in the sand. So I suppose my question, first of all, before we get on to how not to be scared, is how will they know that menopause is starting? Because I think people are looking out for specific symptoms, but it's a little bit more complicated than that, isn't it? Because not one size fits all. So what would you say?
No, and that's such a good point. I think it's important to be familiar with the symptoms that can be associated with menopause, right? There are, I don't know, every time I look, the numbers are increasing. It's like 40 to 60 to 70, but there's so many symptoms that are associated with menopause. So I would say if you are around, you know, your mid-30s and you start to notice any of the symptoms that are associated, it may well be that you could be going through perimenopause. However, it is important that we do not automatically assume that it is perimenopause. So if you're having symptoms of muscle aches and pains, or joints aches and pains, you're like, I don't know what's going on. Oh, is it perimenopause? Go to your doctor, get your bloods done. It could be that you're low in B12, or you're low in folate, or you're low in vitamin D. Those are very, very, very common, particularly in this country with vitamin D. There's no sunlight ever, really. It's barely there. And if you're not regularly taking your vitamin D supplements, you might be low in vitamin D, and that could be the cause of your symptoms. It might be that you feel like you're irritable, some changes in your mood, but there's everything else, everything in your life is great, and you don't know what's going on. It's worth getting your bloods done to check your hormonal levels. So your thyroid hormones, you know, if you're low in your thyroid hormone, that can cause mood changes. So it's important to be aware of the potential symptoms, as I say. I know I'm reiterating this point, but don't put it down to that until you've been assessed and you've excluded other things, because then you know, okay, it's this. I also wanted to say that, and there's a common misconception that, oh, you know, if I do my blood test and I check a specific hormone, so we check for something called follicle stimulating hormone, which is one that's released by a gland in the brain. And that's the hormone that stimulates the ovaries to make the eggs mature. And then the follicles start to release the estrogen. So it's all like a feedback system. And when the ovaries are no longer releasing it, that FSH increases, because it's like, come on, you know, you need to produce the egg. What's going on? So that's why we check. Yeah, basically. So the FSH level rises, and it's high after menopause. However, in the perimenopausal stage, because it's a fluctuating thing, and, you know, it's not definitive yet, we're not there. Depending on where they do your blood test, if they do it at a stage when your FSH level is low, and then you think, oh, then I definitely can't be in perimenopause, I can't be menopause, that's incorrect. Because it could be that you are still in perimenopause, but the levels, when they did the bloods at that point, it's low. And that's why they don't recommend doing it at younger than 45 unless you fulfill certain criteria. And also, it's also why.
Did you say 25 or 45?
45. So they don't recommend it because of those factors. And actually, the British Menopause Society, as well as the FSRH, they often say we don't need to do the blood test to confirm menopause or perimenopause.
No, I go on symptoms,
Yeah.
And that's important for people to understand. And I don't want to make any assumptions here, but the doctor's not going to take your bloods. You're going to have an appointment to go to see the nurse to get your bloods, and then they're not going to tell you the results straight away. They're going to ask you to call in or come in another time. So these things take time. They don't take a lot of time, but these are things that can be done at your GP clinic. But like, to reiterate what Aziza said, you don't have to, menopause doesn't have to be measured through a blood test. The doctor should go simply on your symptoms, and that's why knowing yourself and knowing what makes you tick and knowing what's changing and what's going up and down and all the rest of it is really important when you go to your GP. But please don't be scared to go there, because yes, you may have had a bad experience, but it is likely that you will have a better experience if you are able to advocate for yourself elsewhere.
Absolutely. And I just want to quickly, because this could be life-saving for some women, and it was something that happened to my family member because she didn't realize. If you haven't bled for 12 consecutive months and then you bleed the next day or the next month or a year later, that is not normal. That is not your fertility returning. It doesn't mean, it's just a one-off and you should ignore it. And when I say bleeding, I mean, even if it's just a bit of pink discharge that's come out a few times, or it's just spotting.
Yeah.
If you start to bleed after you've gone through menopause, that is not normal. That is a red flag symptom, and we need to exclude womb cancer, particularly. It's rarely the case. I'm not saying that if you have it, I don't want anyone listening to this panicking, oh my God, I have cancer. No. It just means you need to get checked out so we can rule that out. Please do not ignore that. And with anything, and I love that you spoke about knowing your normal. I'm a big advocate for that. Make sure you do all your self-checks, including checking your vulva. Very important. Check your breast, check everything. Know yourself, understand your menstrual cycle, understand yourself and your body. Because if you notice anything, you notice it early and you get it checked out, and it gets checked out early, and it ends up being something sinister like cancer. Again, rarely the case. The hope is that it's picked up early, where it's more likely to be treatable, and the treatment is successful, curative, and less invasive as well.
And that's really important, because, oh God, we do that thing where women not as much, I will add that, but men are more likely to just bury your head in the sand and hope it will go away. Especially as when we're younger, we feel like we're invincible.
Yeah.
We're invincible. You get a cold, you get over it very quickly. You might go out drinking, you might go on partying, burn the candle both ends and still be able to get up and go to work or do all the things you need to do. And then it gets to a point where you really can't do that, But we still carry that mentality of, it'll go away, it'll go, or we don't want to know the worst. So we kind of just stick our fingers in our ears and start la-la-la-ing. But it's really important because sometimes you find out the hard way, So it's really important to catch these things early, because they are completely preventable and, and completely curable. And if you leave them, it could be something worse,
Absolutely. And that anxiety, to live with that anxiety, I feel like that is so debilitating, that it's constantly in the back of your mind. Like, it could be something, but it's okay. It could be something. You don't want to live like that. It's scary. And look, I am a doctor, but I'm also a human being. I freak out when I find out when I feel like something is wrong. And I thankfully my husband is very much like, Aziza, you're just going to panic, go and get it sorted. I mean, I don't let it linger for long. But that's the reality. We all get worried. We all think of the worst. And sometimes knowing too much isn't the best thing, but it is helpful because then you're more cautious. But once you get it checked and you're reassured that everything is okay, at least that's gone. You can continue to live your life and not constantly on edge or in fear or just constantly thinking. And the other thing that I think, especially as women, we do a lot of is, oh, okay, I'm busy right now, but I'll get to it. And then we keep delaying it. And actually, there's a public figure, Dr. Julie, who's a psychologist, who's recently come out and shared with the world, which was very brave of her, that she's found a lump. She'd found a lump, and it turned out to be breast cancer, and she was going to delay it. She was busy in the process of finalizing her book that she thought, I don't have time for this. And she says this in the video. which again I thought was really brave. But it's so relatable where it's like, man, I'm so busy, I can't deal with this right now. But fortunately, she didn't.
You can't put off your health. This
No.
is the thing, and I think this is something I've really appreciate as I've gotten older. I mean, it's that whole, if I'm not healthy, then I'm not living.
Yeah.
And we do that thing where when we're younger, I don't want to sound patronizing, but we think that everything will be fine, and then people do not make it to the next day. So I urge people, and this is also a plea, to check your boobs, please. Check your boobs in the shower, in the bath, check for any irregularities, because these things can be caught and they are treatable, as you have said. So thank you for that. I also want to add, people listening to this won't see this, but when Aziza's talking, she's been waving this vulva around. And what I love about this vulva, it's brown.
Yeah.
It's brown. Like my vulva.
Yeah.
And I this makes me so happy. And it's something that we've taken for granted because we see, let's say, white genitalia, don't we, all the time. And what I love about your page and about you is that you are advocating for and showing and talking about and displaying all these different shapes and sizes, and so it seems like such a little thing, but that representation, whether it's a brown coloured patch, HRT patch that you can put on your skin, to as I said, the waving a brown vulva around. I want one so I can wave it. These things are really important. You don't realise how important they are until they're presented to you. So I want to thank you for that, because that's so cool.
Do you know what?
So cool.
I want to really quickly share another quick story and explain why it was so important to me, right? So before I got the brown crochet vulva, it's crochet, not knitted, because the crochet community will come for you. They came for me. I didn't crochet.
Is it from Manchester Menopause Hive, or is it someone else?
Oh, no. This is someone else. She's
okay. All right.
I'll send you the link. But she does it too. She's amazing. She is so talented. She's made like a gigantic one as well.
Okay, what's her name? Do you remember her name?
The one from Etsy. I don't remember. Project.
Okay, it's fine.
I'll send it to you anyway.
It's all right. I'll put it in the show notes when I get it.
But basically, I wanted to do a video on how to check your vulva, okay? Because it's something that not many of us do, and there's a lot of stigma, shame associated with it. It's very hypersexualized, but it's important to do because there are people who are being diagnosed with vulval cancer, and they're getting diagnosed late because they don't check it, right? And I knew that I wanted to showcase a brown vulva, because if I am showing you how I check my vulva, I want you to see what my vulva looks like, right? Because it's brown. I mean, I'm not going to show you that I check my vulva and then it's a white vulva, right? So that was really important to me. So I went on Google to see if I could, use one of the sketches online, and I couldn't find any. I could not find any. So I had to get my cousin, who dabbles in animation. And I said, can you draw this line diagram of a vulva for me? And she did, which is great. And that really hit me. And I was like, you know what? From now on, and I was already using, this bad boy for...
So many toys in this room. So what's this now? That's so cute. What is it?
Oh, it's a booby. Breast. So when I showcase how to check my breast, I always use little cute props because I think it's just more acceptable.
I kind of want one of those for my grandson. Why do you? That sounds really weird. Maybe I should.
No, my son used to play with it a lot, and he's 3 now. When he was a toddler, but so it's so important to me because we don't get that representation. And actually, from that video, someone paid attention. As a Black woman, she paid attention and realized, oh, this pertains to me. Because it's that relatability. That's why representation is important. You won't always pay attention if you don't see it. You won't believe it. You can't be it. And thankfully, because of that, she's now been diagnosed with a condition that had she not known and it had progressed, it could have developed into cancer. So that's why it's important to me. And I appreciate you thanking me for that. But again, that's why I like that your podcast is called Menopause Whilst Black, because again, we need that representation, and it's not spoken about within our community enough.
And whilst we're on the cultural nuances, so talking about black women, black people who experience menopause, we are likely to start our menopause journey 8.5 months and up to 2 years earlier than our white counterparts. So people who are holding on to the average age, where average age is, beginning of the 40s when you start perimenopause, and then say 51, 52 when you're going to go into menopause or stop your periods, etc. If we're not holding on to the numbers, how will they know that menopause is starting? Like what are people looking out for? Is there anything in particular? Or could I suppose it could be anything, couldn't it?
Yeah, it could be. I mean, genuinely, like I said, it's just any of the symptoms that we've spoken about. So the hot flushes, the aches and pains. If you start to notice that you're getting forgetful, poor concentration, if you've noticed, and we haven't spoken about this, but vaginal dryness, have you started noticing that you're itching down there, or you feel like you're not getting as much discharge as before? Sex has become painful. And, if you're looking at those sort of changes happening within your body, those are often signs of low estrogen. And so it's a sign that you could be going through perimenopause. So as I say before, if you are going through any of these symptoms, just go to your doctor, get checked out and have the conversation. And don't allow yourself to be dismissed. If you are a Black woman or a South Asian woman, because South Asian women actually have it even earlier, and you are in your late 30s, mid to late 30s, and they've done all the checks and everything is negative, you can say to them, look, based on my symptoms and the tests, would you not consider that this could be perimenopause, and really push for that? That's what I would say.
Yeah, because some doctors, you have to put that word in their mouth, in a sense.
Yeah, for it to click.
I would say that. And also, I now realise with hindsight that my periods changed.
Oh, yeah.
I had been off work forever.
Yeah.
And fairly kind of 4 or 5 day situation, which isn't awful by any stretch of the imagination. And a lot of people I talk to say that their period, they've started to flood, or that their period, they might have a 6-week gap and then a 2-week gap, or they might become more painful. Mine just disappeared. I literally had, I don't know, a 2-day period. I mean, it's great, but it was, I now realise that was my, my body preparing itself.
Good point. That's also very important to remember. So if you're over the age of 45 and you're going through that, we can often equate that to potentially it being perimenopause. If you're under 45, we definitely need to do some checks just to make absolutely sure that we're not missing anything, because, and like you say, it could be that the periods may become more regular or more irregular or heavier or more painful, passing more clots. All these things can happen as a symptom of perimenopause, but those symptoms are also associated with other conditions such as, STIs, so a sexually transmitted infection, or it could be that you might have developed fibroids, which you can do as you get older, or something going on within your body. And again, like very, very rarely, as I say, I'm not trying to scare anyone, but it could be, is it a gynecological cancer that's causing these symptoms? But
too late, they're all really scared. But I was going to say, what would you say to anyone who is scared?
I would say,
I have 2 questions. What would you say to anybody who's scared of the whole menopause thing? But also, how, I suppose, hand in hand with that is, how can people prepare themselves for the onset of menopause? Because it's such a large part of our lives, and it starts earlier than we think it does. So we can make it easier. We can make that transition easier. How?
Of course. Okay, so in terms of your first question about being scared about menopause, first of all, I would say that the reality is most people who go through bad experiences, they're often the loudest. Okay? Because there are some individuals who breeze through menopause. And I'll give you an example with it being my mom. She barely had symptoms. I mean, maybe some irritability and some things with her mood, but when I speak to her, she doesn't I volunteered information, you have to ask, but she didn't have, a terrible experience per se. So I just want everyone to know that it's all individually based. And just because this person had the worst experience ever, it doesn't mean that it's guaranteed that that's what you're going to go through. And just because someone, it went on for 10 years, it doesn't mean that that's what's going to happen to you as well. It's always helpful to be equipped and know that that is a potential, but it's never guaranteed. Okay.
Yeah.
And usually take all the stories, I would say, like obviously listen to it, know that they exist, but also know that there are options out there and don't allow yourself to suffer. Okay, is what I would also say. There are treatment options. You know, I know a lot of people, especially within our community, are scared when we talk about HRT, but for a lot of people, that just gives them their life back. You know, and all HRT is, hormone replacement therapy, is literally the estrogen that you have lost. We are giving it back to you through the form of HRT, as well as progesterone if you still have a womb, because it protects the womb lining and reduces the risk of getting womb cancer if you're having estrogen constantly without that protective factor. So there's that. And then obviously there are the alternative treatment options that are there. So some people use acupuncture, or they take the black cohosh or red clover leaf, or evening primrose oil, all these other things. But most importantly, lifestyle is also there. And that I will then move on to the next bit about how to prepare. When we talk about health in general, it's a marathon and it's not a sprint. Okay. So it's not about the summer bodies and oh, I'm going to get to this goal. Our goal should be what we want for the rest of our lives. And the earlier we start, the better. Right. Yeah. So I'm talking about if you're in your 20s, obviously I know you want to enjoy your life, but enjoy it remembering that you want to get to the other side, and you want to get to the other side stronger and healthier. So lifestyle is so important. Get your exercise in. You know, the recommendation is at least 150 minutes of moderate exercise a week. And it doesn't have to be anything too strenuous. If you are, you know, a really busy mom, try and go on walks where possible, you know, like brisk walks for 30 minutes if you can. If that means that you're going out with your kids and going out for that walk, or, you know,
dragging them up the hill.
Exactly. or, you know, there's so much on YouTube. You could just do one of those videos. Try and make time for yourself, prioritize yourself. We're very time poor, especially again as women, but it is not selfish. It is important. Healthy mom, happy kids, happy life, happy everything. Get the exercise in, and also make sure that you are not smoking, please. And I mean vaping as well. Like there's a new lung condition that's happening because of vaping. Please stop. Yeah. There's no point. Don't even start. And there's so many young kids who are vaping right now. It's so scary. And the thing is, because it's such a nice flavor, they're vaping, and the amount that they're having in one setting compared to actually smoking cigarettes is even worse. So just don't.
I remember watching a program about how the vape industry had deliberately targeted teenagers and young people, and it upsets me when I see people vaping, you know, in a cool way, like smoking used to be. Okay, because I just think you don't know what's in that. Exactly. And I worry, because I like to worry about the health indications and outcomes for people in, let's say, 5 years, 10 years, you know, the lawsuits, etc. Time, if we lost it all.
Yeah, and that's exactly what happened with smoking. Because I am old enough to remember the Marlboro man with the cowboy hat.
Yes,
They used to have those adverts, and now it's obviously the exact opposite. So please just don't start if you can, and if you can stop. I know it's really hard, and it's easy for me to sit here and say, but please, there's help and support out there to stop. The other thing is alcohol. Depending on who you talk to, some will say don't drink at all, or just drink in moderation. Don't have more than 14 units over the course of the week. So I don't mean have all the 14 units in one day. It's spread over the course of the week. And then also try and maintain a healthy weight. That's really helpful as well. And really quickly about exercise, I want to talk about weight training, because everyone's scared about, oh, I don't want to look like a man. Actually, weight training is even more beneficial than just cardio. It works on everything. Like, and the bonus that we get, like I've already told you that with menopause, we get the bone resorption, so our bone thins. Strengthening the muscles around helps with the bone strength as well. So muscle strengthening exercises is really, really important. Eat your fruits and vegetables. Get your fruits and vegetables in. They're so important, and they can really help and benefit us in the long run. And I just wanted to quickly quote Chadwick Boseman because, he was such an incredible human being who we lost so soon. When they asked him about aging, what his thoughts were, and he said, it's a privilege. Be lucky that you're not dead, because that is the alternative, isn't it? And he said that when he would have been diagnosed with cancer. So aging is a privilege. It's a gift. It's an opportunity that not everybody gets, because we can't choose, but we can definitely improve our overall life experience and expectancy just through living healthily.
Thank you. That's beautiful. That's perfect. Back to you then. You have 2 young kids and a hubby. Do you have a routine? Like, is that a thing? Do you have a morning routine or something you get? Because obviously they're on summer holidays now as well, aren't they? Oh my goodness me.
So I'm going to say that there are so many people on Instagram and socials, and you look at them and you're like, how are they living this way? And actually, I have people who say to me, oh my God, how are you doing all of this? It's incredible. It's amazing. I am literally a work in progress. I'm a human being who is trying to perfect this life, this motherhood, this experience. But I try not to beat myself up because, I think it was Shonda Rhimes who said that when you're excelling in one thing, you're not going to excel in the other aspects. But we need to be, we need to be compassionate with ourselves. We need to give ourselves compassion and do what we can, what works for us and what's possible. So I'm very fortunate that my husband is quite supportive, and I do have supportive family who are around, and I'm not afraid to ask for help. I'm also very fortunate. I have amazing neighbors as well. So for me, routine is important, but having that support system, that is what's helping me thrive 1,000,000%. So hold on to your support and don't be afraid to ask for help. Please ask for help. Even superheroes have a whole team, like the Avengers. I love Marvel, right? They don't do it alone. They have a whole team. And that's what makes magic.
That is very true. That is very true. What brings you joy, Aziza?
What brings me joy? Yeah, these sort of conversations. I'm not going to lie. Earlier today, I just felt a little bit, I think I was just so tired, but all of a sudden I feel so energized. And I don't know if you noticed, as the conversation has gone on, I picked up energy, and this gives me joy.
Because you're passionate, and you're talking about your passion as well.
Speaking to people like you, meeting so many hardworking and passionate individuals. And to be honest, the platform, that sort of started by mistake. I didn't anticipate that all of this would happen, but it's incredible. It's been so rewarding. And for me, the biggest reward is that, there are people I've never met, I may never meet, who are learning about themselves and who are potentially seeing their doctors and hopefully no longer suffering just from, 20, 30-second video or a minute clip that they've seen of mine. And it's made a difference in their lives. Like, I don't think we realize the impact that we are making to other people's lives. Like, this changes, it saves, it impacts lives, and that brings me a lot of joy.
Oh, that's beautiful. That's very noble as well. Which tune instantly makes you want to dance?
Okay, so this is a really silly song, but without fail, it's not Beyonce, It's actually, oh God, what's his name? Trey Songz. It's a song that he didn't even release, but it's just a cute song. It's so silly. It's put your number in my phone. Just forget about your man, baby. Call me up. It's such a silly song. But if that song comes on, I'll be like, yeah.
Aziza is the first guest who has not only waved a brown vulva around, but also sang a tune to me. I feel serenaded. Thank you for that. And we don't even know what it's called, but I'm sure if I put it into Shazam later, we'll find it. Final question. Can you believe it? What's the one piece of advice you would give to anyone listening to us right now?
Because this is a health podcast, I always say don't give up. Please don't give up when it comes to your symptoms and seeking help, and just whatever your struggles are, please, please don't give up. I promise you, there's light at the end of the tunnel. There are treatment options out there. There is support. If you feel like you've been dismissed or you've not been listened to, I promise you it's not always going to be that way. It will get better. Please don't give up.
Thank you. Thank you. Aziza, it's been an absolute pleasure. I love talking to you. I mean, I always love meeting you. You're always a breath of fresh air. So I was very excited about this conversation. Thank you for your wisdom. Thank you for your knowledge. And hopefully I'll see you in real life soon.
Yes, definitely. Can't wait to see. I always love checking out whatever outfit you're going to wear. You always bring up a room, no lie. Thank you for having me, and thank you for everything you're doing. You're an inspiration, and I look up to you 100%.
Dr. Aziza Sesay is a tonic, let me tell you. I really loved talking to her, but what kept me, giggling, but also was heartening, was seeing her wave her brown vulva, crocheted vulva, just so we're clear. I don't want to get in trouble with anyone, with any censorship, and her plush toy booby in the air. It is really important, as she said, representation really matters, and it really helps with helping these messages to land. You can hear the same message over and over again, as we said in the podcast earlier. But it lands when it lands, and sometimes it needs to be through the people talking about it who look like you, people who resonate with you, and sometimes that's also around using air quotes toys that are brown and look like us. So I'm glad that she started to use these, and now she's become very famous for whipping them out wherever she is talking about menopause or about sexual reproductive health, which is most of the time, let's face it, because she's that kind of doctor. But yeah, I really enjoyed talking to her. Dr. Aziza is very happy for you to reach out to her on social media platforms, but do remember, as a doctor, she is not going to diagnose you with anything without actually seeing you for a consultation. So just be mindful of that. But yeah, that was a great episode. And I love that she took us back to basics. It's very easy to assume that because we've been talking about menopause, or we talk about menopause a lot on this podcast, it was nice to be able to go back to, well, what is menopause? And what do you do when you go to the doctors? And what if you are scared? So I was glad that she explained that and took us through what various letters meant. If you were a little bit confused, I have explained a little bit more in the show notes, so you can have a look to see all the links that we talked about. A little bit of news I've mentioned before, if you've listened to this podcast before. By the way, if you're on YouTube, you will have seen this in full, Technicolor glory. So if you do have the opportunity, if you're not watching this on YouTube now, to hop over there and see Dr. Aziza waving her sexually reproductive toys around, please do so. And then you'll also see my lovely green irregular sleep pattern PJs that I never actually wear to bed, but that's another story. So, my news. What is my news? I am speaking on the structure of intimacy, which is around podcasting at the Women's International Podcast Festival on the 4th of October. The festival runs on the 3rd and the 4th of October. Which by the time you're listening to this is tomorrow and the next day. So you still have time to get tickets, hopefully. If you want to go into podcasting yourself, or you want to up your podcast game, this is a wonderful annual festival that you can really rub shoulders with the people who know what they're doing. And I'm one of them, apparently. So there you go. And if you want to come along, just follow the link in the show notes, and that will take you straight to the page for the International Women's Podcast Festival, which is run by Content is Queen. I'm very excited to be part of that. And I'm glad that I was asked, frankly. It's going to be a lot of fun. What else is happening? Did you know I wrote a book? Did I tell you I've written a book? I've written a children's book. I mean, it's a slight curveball. You couldn't make up my life, honestly. I've written a book called Grandma's Locks, and it is being published by Tate Publishing, and it drops on the 24th of October, 24th of this month. I would love for you to pre-order this book. It is about the love and celebration of African diasporic hair through the relationship between Grandma, me, and her grandson, my grandson. So yeah, Grandma's Locks, LOCS, with Tate Publishing. Pre-orders matter. It is difficult enough for marginalised authors to get their word out there. So if there's any way that you could share or let people know or pre-order the book yourself, that would be absolutely wonderful. And let me tell you a little secret. I got the first press copy today. I'm going to do a little unboxing over on Grandma's Locks Instagram page. I'll probably share it on Menopause Whilst Black as well, but it's beautiful and I can't wait for you to read it and share it and hold it in your hands and see the wonderful illustrations by Camilla Rue. Okay, that's enough about that. Finally, the Joy Retreat Barbados. If you are interested in joining me and 10 other Black women to go to Barbados, it is for Black women in any stage of menopause. We are going to Barbados on the 28th of April to the 5th of May. We prioritise rest. We prioritise setting boundaries. I work with 2 facilitators, a yoga teacher, Yasmin, and a craniosacral therapist called Louise. And I'm excited to bring our program to you, a whole new batch of 10 beautiful Black women to Barbados with us next year. So if you would like to join us, you can go to my website, menopausewhilstblack.com, or you can drop me an email if you want a little bit more information at hello@menopausewhilstblack.com. I had to think about that because it's a new one. Or hit me up on Instagram, Menopause Whilst Black. What else? That's kind of it. You know what? I'm really grateful to you for being here. I'm receiving messages from people who are either catching up or they're discovering the podcast for the first time on YouTube, on Spotify, on iTunes, wherever people are listening. And it is beautiful to receive these messages when the stories resonate. So I want to thank you guys for listening. As always, I would love you to leave a review on the platform you listen to share with people in your workplace, to talk about Menopause Whilst Black, to spread the word. Hey, we're in World Menopause Month this month, so really take the opportunity to talk about menopause with as many people as you can, because it's important to ensure not only that menopause matters, but also that we normalise this chat. I think I've reached the end of my messages. I'm cold. I'm not going to lie. This transition from summer to autumn has been brutal. I don't know whether you feel the same, but I'm sitting here with a lovely little mustard blanket on my legs. I hope you are managing to stay warm. If you're in the UK, if you're in somewhere warm, let me know where you are. How was it for you? Do you have a winter? Do you have an autumn? Do the seasons change? Tell me about where you are. I would love to hear from you. hello@menopausewhilstblack.com. I'm rambling now. Listen, drink your water. Continue to wear your SPF whenever it is daylight. That sun is not playing. Look after yourselves. Do no harm. and take no SHIT. All right, I'm going to leave it there now. Have a wonderful day, evening, week, and I will speak to you again next time. All right, take care. Bye.